All right, y'all, welcome back to Level the Playing Field. You know, our podcast and YouTube channel talking about sports medicine, health overall, and the pathway to health professions. I have a special guest today, Mr. Robbie Jackson. He's going to be joining us, giving us his perspective about his pathway throughout sports, youth sports involvement, and medical device sales, and some great insights about things that we can do to kind of enter the medical device sales kind of specialty. So thanks for coming on. I really appreciate you having us. Yeah.
Yep.
Yeah. So just give me kind of a background about your current path and what got you there in the first place.
Well, currently I'm in medical device sales. Pretty different pathway than what I had, where I saw myself from college till now. I was mentioning earlier, I have a sports management degree. So not necessarily happen to have a biology degree, so to speak, to be in device sales. It's about the experiences there. But kind of got into it accidentally. Coming out of college, I was training at this facility, preparing for the NFL. And that didn't work out. Stayed at the training place to work out, and they asked me, did I want a job there? I'm like, sure, I'll train some people. I like fitness. I was always intrigued by the human body and things like that. And so I started doing that, and then got promoted, and I started running the program and all that. So everything went great. And I was living in Maryland at the time, and I decided, I want to move back home to Richmond. I looked up American Family Fitness here in Richmond. Was able to transfer down here. Got a job with them, and really enjoyed it. Loved the fitness life, and I was certified as a personal trainer. I actually was able to start teaching for American Council of Exercise, preparing other folks to be certified as well. So I was really both feet into it. And then I was like, I think I want to do something different with my career. I want to, this has a ceiling on it from the fitness level here in Virginia. But I wanted to keep growing my career. Wanted something a little more lucrative, preferably. I had some plans for the future that I wanted to accomplish. So a buddy of mine who I worked with worked in pharmaceutical sales. And he said, you'd be fantastic at this. You do well here in their fitness sales. I think it would transfer well into pharmaceutical sales. You have an expressive personality. That's what you need, that kind of thing. So I'm like, all right. So I started digging into it a little bit. Went on a couple field rides with some friends to kind of see what a day in the life, how it really was. I'm like, yeah, I can do this. This is kind of, simple. It wasn't simple, but it was, that was my thought at the time. So I interviewed for a couple different companies. I got a job with a pharmaceutical company, and I'm like, all right, now I'm kind of where I want to be. My territory, I was living here in Richmond. My territory was Hampton, Newport News, and all that. So I was traveling a good bit each day. I was going to eventually have to move into my territory, but at the time, my wife was pregnant with our quadruplets. I'm not sure if I told you that or not, but yeah. So I was kind of going back and forth, and I'm like, all right, this is getting difficult. I have to have a cup of coffee just to make it home. I was so tired because of when they were born. Yeah. So I said, I need to move to Richmond. I need to be there. All of their help and stuff is here. So I started looking at the jobs within the pharmaceutical sales realm here in Richmond. And one day I was at the driving range hitting a bucket of balls. I was supposed to be at the store for my wife, but I stopped by the driving range. And so I'm hitting some balls and looking up, and this guy's staring at me. I'm staring at him like, who is this guy? Long story short, it was a guy who I used to train his wife when I was a personal trainer. And he said, my wife works for this pharmaceutical company here in Richmond. She's looking for a new counterpart. What do you think? So I gave him my card, interviewed, and got the job here. So that worked out. And then it was a much larger company, so it really worked out for more reasons than one. And then my career path started to grow a little bit more. I was in pharma for about 16, 17 years. That company did some shifting around, some downsizing. So I went to a couple other companies as well. And then most recently, 3 years ago, a recruiter reached out to me about medical device sales. And really it was because of, my background from before, including fitness, because my interview process, they even asked me about that. Yeah. So interviewed for the couple of different companies actually were interested. So I interviewed with them, got a job with the company I'm with now, and I love it. I'm in cardiology. So it's a field that I've always worked in the pharmaceutical realm as well. I sold blood pressure medications before. Right. But having always been intrigued by the human body, by anatomy and things like that, it was a wild but seamless transition, if that makes sense. Everything I had learned and done in the past helped and led up to where I am now, and what I do from a career standpoint. And when you're in the midst of it, you don't really realize that this is why I'm doing it, or this is where it may lead to. But when you look back, you can start connecting the dots and say, all right, this is because I believe everything you go through is preparing you for something else, whether it's a job, a relationship, whatever it is, it's preparing you for your next. You know what I mean? So I'm positive that my career moves and career steps got me to where I am now. So long story, but that's kind of where my transition, how I got to it.
Well, I mean, that's a blessing to see each step of the foundational pathway kind of lead to where you're at now.
Yeah.
For some of the younger people in the audience, can you break down what exactly medical device,
Yeah. So a medical device is what it sounds like. It's the sale, so to speak. I don't necessarily sell per se. I'm an outreach and education manager for my company. Therapy development manager is my actual title. But it's the marketing of a device. In my case, it's a heart valve. It could be an orthopedic device, things like that. It could be something. It's just a device that's used within surgeries to treat a patient's disease state, whatever that may be. So again, like my situation, I'm in heart valves. So I'm speaking with structural heart physicians, interventional cardiologists, general cardiologists, and primary care doctors as well, just to kind of create, bridge a gap between them, because they're the ones who are treating the patients who are in my disease state.
Absolutely.
So again, it's a device itself, regardless of the field that treats the patients, different than pharmaceutical sales where I was selling medication.
Absolutely. So you kind of pointed to kind of the teamwork or team aspect of healthcare. So there's physicians, and people think, oh, the doctor does this, doctor does that, right? But we really can't function without, those who kind of help educate us and create the medical devices that let us change lives.
Yeah.
Right. And so it's really a back and forth.
Yeah.
And so I always point out to people the teamwork aspect of things is what leads to success in this field.
Absolutely. Yeah.
So just to take it a step back, you had mentioned you had NFL aspirations at one point and had to make a pivot. Can you mind expanding on that?
Yeah. So I played football at Towson University in Maryland. During my senior year, I had a knee injury that was kind of mysterious. Didn't know what it was, what was going on, and I couldn't function properly. I actually had taken a step back further. I'd pulled a hamstring a week before camp. That finally healed up. Bruised some ribs during the game, like third, fourth game of the season. That finally healed up. Then my knee thing happened. So, we weren't doing very, very well. My coach was thinking I was just kind of tanking the season, preparing for the NFL and all that. I'm like, nah, I want to play, So the season went on, and then I started preparing for the draft. I was working out with different teams, things like that, and I couldn't run. I was a smaller guy, I played running back, so speed was kind of my thing. So my times were down and all that. So it was all because of this knee issue. And then when the draft went by, didn't get drafted, didn't get signed as a free agent over the successive weeks. My agent's like, listen, just go see your doctor, get a surgery, and see what happens. So they did an exploratory arthroscopy on my knee.
Okay.
And they found out that it was a bone chip in my knee that had broken off in a game sometime during the season and was floating around, kind of catching in my knee. I forgot the exact terminology that he used. Yeah. So they went there, shaved it down, pulled that out and everything else. But once that was done, like it literally put like an awful taste in my mouth about football at that point. Okay. And I didn't even watch football for a couple of years after that. Like after the NFL was done, and I was hindsight, I was kind of in a depression behind it. You know what I mean? But I enjoyed fitness, and I still worked out where I was training, to go in the NFL. And that's how I kind of got into the fitness bug, because I was always, I always did really, really well in the weight room. And I was fortunate to be a national strength conditioning All-American when I was in college. So it was something that I really gravitated to and I had success in. So I think that was kind of feeding that competitive nature. I actually was a competitive bodybuilder after that as well. So all that fed into that same competitive drive from football. So I just transitioned to the fitness and bodybuilding side of it.
Oh, absolutely. So clearly, those skills you developed along the way, like we said earlier, kind of foundational to get there. So like a quick aside for me, something I did early on is I worked at Foot Locker, right? Selling shoes, right? And so you'd be surprised how much that translates into my current job as an orthopedic surgeon, right? Having to engage people, right? And find out what your needs are. Oh, you said you need a size 12. Well, let me show you what this looks like. I think you might need a wide instead of regular, right? So that translates right here. Yeah. Oh, I think something's going on with your knee. We should probably get an MRI, but let me engage you where you're at. Yep. Yeah, you probably saw some similar things.
Oh, absolutely.
Translating skills, yeah.
I mean, you learn how to effectively communicate with people, because everybody's different, first of all.
Right.
So that's one of the first things I learned, was how to speak to people differently to get them to understand what I was saying. You know what I mean? And in sales, for example, you're trying to for lack of a better term, persuade them to see your point of view.
Yeah.
And that works with my wife sometimes too. Sometimes. But it's those same skills that I was, trying to sell a fitness package to, I use today. I use right now, because that was like the foundation of my work world, really, in all honesty, after college. So, those same skills and being able to show someone, to educate them on why this works for them, why this will be good for you. I do the exact same thing now in speaking to physicians and to patients. I do some direct-to-patient education as well.
Exactly.
So I do both. So for both of them, I'm using those same foundational skills to this day, So to your point, yeah, I mean, it's, again, everything you go through at some point in your life is preparing you for something else. I firmly believe that.
Yes, sir. Absolutely. And it's all a blessing.
Absolutely.
You take every experience and
Indeed.
get what you can get from it.
Yeah, and absorb it. So I think I have this phrase now that we mentioned that I was coaching as well. So I use this for a long time with my players is don't be an autopilot. So but that's everything. You can't be an autopilot where you just kind of go through the motions and check this box and that's it. When you're going through something, you have to pull from whatever that experience is. You know what I mean? Like your experience with Foot Locker, things like that. And sometimes you don't really get it until later on.
Exactly. Yeah.
But if you're engaged at that time, then you'll get it later on.
That's
right. But if you're an autopilot, you may miss the whole message. You may miss the whole education piece of it. And why you went through it in the first place.
Yeah.
So
No, that's a powerful message. So you engage with patients directly from an education. That's powerful. Tell me more about that. What have you encountered in terms of patient education? What they need to understand?
Well, in our case, with the being cardiovascular realm, it's a disease state. It's severe symptomatic aortic stenosis and essentially heart valve failure, basically, right? It's the symptoms are syncope, dizziness, shortness of breath, things like that. And a lot of times, the patients who are in this group, they're older patients, and they attribute those symptoms to being I'm just old, I'm just out of shape, that kind of thing. So we do it, and I speak with them some, but I usually bring in surgeons to speak when I have these dinners and such. I will have them at independent living facilities. I'm working on one with a large church right now, things like that. But we'll bring them in to talk to the patients about what the disease state is and help them advocate for themselves when they go see the doctor. Yep. So they go see them and say, listen, my stairs are a little more challenging now. Or walking from the car to here, I'm a little more out of breath than I usually am.
Right.
Because normally they're going to attribute that to just being, I'm 75,
right.
not them having a heart valve issue. So now they can say, yeah, well, at this program, they mentioned this, and I have the same symptom. Or I've been getting a little dizzy lately. So it helps them talk about that more. Because sometimes from a primary care setting, they may not be able to tease those symptoms out. And sometimes my particular disease state, the symptoms can really be masked as something else, as you can see. But most patients who actually present with no symptoms usually present with symptoms once they go to the cardiologist. The goal is to get them there in the first place, right?
Gotcha.
So we educate the patient and being able to talk to their primary care doc about what they're going through to kind of help their process, and so they won't fall through the cracks somewhere.
That's outstanding. I think a large kind of disconnect, especially in our community, in the African American community, is education.
Yeah.
And education with the purpose of empowerment to advocate for yourself.
Yep,
so I'm so happy to hear that you're involved with that. We try to do the same thing in orthopedics, right? And we see some of the same gaps. Now, kind of bringing it around full circle. So June is Men's Health Awareness Month. I don't know about you, but when I encounter a lot of men, you know how that Y chromosome gets us. That stubbornness is built in. So there's a whole lot of I'll just push through, or this and I'm just get through this. I'm tough and what have you. Do you encounter that when you're engaging?
Oh yeah, it's even with friends. but not really with the patients too much. Again, the folks that we're talking with, they're 65, 70, 75. So they're, sometimes by force, they've been forced to go to the doctor for one reason or the other. Unfortunately, they've had an issue or might have had an event that has forced them kind of into medical care for some reason, direct or indirect. So not a whole lot, but that is an issue in that community. And looking at the numbers, so folks getting the procedure that we do a procedure called TAVR procedure, where they get a heart valve replacement. It's not open heart surgery. It's through a catheter through the groin.
Okay.
So in looking at the data on who gets either one of those procedures, it's in African American patients, it's so low. Like, I mean, a minute percentage of the patients who get the procedure. Why? Like, what's going on? So we're doing some stuff right now. Our company actually is working with the NFL even to putting some things together direct towards my minority patients to create education and awareness, so we can kind of change that disparity in the number of folks who are getting the procedure. But I think a lot of it is and we can go deep into the Tuskegee experiment and things like that. But
let's go deep.
A lot of it is that. I think it's where it's uncomfortable sometimes to go to the doctor about certain stuff because you really don't know or don't know what may happen. Well, I feel fine, so why should I? I'll be fine. And it's almost like out of sight, out of mind. And I'm like, well, that doesn't make what you may have going on go away. You know what I mean? You still have to have, certain care, certain tests at a certain age, things like that. So I think it's a lot of apprehension from that side of it, from just the risk and concern about what will happen to them and what may happen to me. Or I have a close friend of me, and he was like, I was feeling fine until I went to the doctor. Then all of a sudden I started feeling bad. I'm like, well, whatever you had going on was still there. Anyway, going to the doctor didn't make you feel bad. He didn't give you anything. It was there anyway. He just uncovered it. You know what I mean?
Exactly.
So that's part of it too. And then, locally, sometimes our physicians, the Black physicians, primary care want to refer to other Black physicians. It just happens because of the patient base. They just feel more comfortable. Yeah. Well, from a cardiology standpoint, there's not many cardiologists here in Virginia, let alone in the Richmond area, who are Black cardiologists. So some patients are just choosing just not to go at all. I'll be fine. I'll just go to my primary care. They can't manage all of your cardiovascular needs.
That's
you know what I mean?
That's right.
Excuse me. So that's, as strange as that sounds, that's also an issue that we're trying to combat as well. It's just to just create the awareness and the sense of urgency that, okay, you may be concerned about the doctor, but just do your research, you could do due diligence, find a reputable one, but go to see a doctor.
You got to see.
It doesn't have to be someone who's African-American. I get the understanding, I get the comfort level, because again, these are older patients, 65, 70. Imagine what they've seen.
Exactly.
Compared to what we've seen when they were younger. So all those things are still in the back of their mind as far as hurdles and barriers and possibilities to go through when it comes to medical care. So one of the hardest things is changing their habits now and their thought processes now. So I think that's an ongoing challenge, I believe, in any medical profession, is just to get them to trust you guys, to treat them and take care of them in the right way, and to and that everyone is taught to do no harm, in the beginning, and but that's difficult sometimes. I think it is definitely a hurdle to overcome. There's no other reason why that disparity is there in the number of patients who are getting the procedure that we have, and who isn't. There's no other reason why than just apprehension about what could possibly happen to them.
Yeah, that's right. And we see that kind of disparity in all aspects of medicine, orthopedics, cardiovascular, you can go down the list.
Yeah.
I think you kind of noted this. The healthcare system historically has not done a good job.
Yeah.
Has done a good job excluding us, right? Some of it intentional historically, right? And we're now coming back and trying to resolve those disparities.
Yeah.
And that affects us, that affects rural communities, that affects, people whose English is not their first language.
Right.
Right. The system has done a bad job engaging, or you could say a good job not engaging, based on how it was previously built. And so we're trying to come back from all of that disparity. And so having people like you who are really engaged and understand that, are coming from that different angle to engage communities is critical.
Yeah.
So I'm getting to the point that we need more people like you.
Yeah. Right.
We need more people like you.
Right.
For those who are kind of younger, who might be having interests in different aspects in their career, what's kind of your advice to them coming up and looking at different career paths?
One of the best things that's in school when it's done the right way is like career day, like bringing people in to really hear what it's about. But it doesn't beat being there, like having a child maybe shadow a physician to some parts of the day. Or I did a preceptorship one time when I shadowed a physician, and it changed my whole perspective as an adult.
Yeah.
But as a child, just being able to see certain things that they see on TV, but hey, no, it's right here. It's real to me. It's real. And certain communities, a lot of it, for our communities, a lot of it isn't real. It's not a possibility. I can't get there. You know what I mean? We got to break those barriers down some kind of way. And I think that the first thing to do that is bring them to the situation, like bring them to where they could possibly be. Because sometimes, as a child or teenager especially, they don't know what they're interested in until they experience it.
They see it.
Oh, yeah. I really like that,
Yeah.
But until you actually are there and see what it's all about, you can't get the full feeling of it, experience of it. So I think, either bringing the career to them, but more importantly, bringing them to the career, just experiencing it, going through it, researching it. And the thing is, the other barrier is parents from a parental standpoint. The parent has to believe that too. And I've heard of stories where the parent prepares a child for a very basic, we'll call it, lifestyle, as opposed to something more extravagant, because that's what they know, right? And sometimes, I've heard stories where it's almost a jealousy of parents when the child is about to achieve more. I'm the opposite. I tell my boys all the time, I want y'all to be way better than me.
Way better than
me.
me.
Do way more than me. That's my goal as a parent.
Yeah.
Everyone doesn't feel like that, so I think that's one of the barriers. So, removing the barriers of educating these kids on what the possibilities could be, and then exposing them to it where they actually see, oh, I can do this, or people like me are doing that.
Right.
I think that's what helps big time. Just making it real for them, and just giving them a lot of opportunities. Because if someone's going through high school, let's say if they're in middle school, for example, about to go to high school, and they see, well, all right, I saw what Dr. O does. I'd love to do that. Now the focus and motivation is different in high school because they know I have to go to college and do this, go to medical school. So now I'm going to focus harder here and better here, so I can get to there. They have to understand what the steps are.
Yeah.
It's not like you just blink your eyes and I'm there. It's a process to everything. Some things just take what it takes.
Yeah.
But a kid has to understand what those things take first, and then the parent has to help them set those steps to be able to get there. That has to happen first.
Oh, 100%.
Yeah.
And you made an important point about understanding the steps to get there. So a large part of educational disparity that I've seen is that people maybe have an interest or maybe have gotten that interest, but maybe it's on the side of being too late. It's never too late, right? But for instance, if you're in college and let's say you want to go to med school, right? There's some things you should have been doing from freshman year, right, to kind of prepare, right? And so I see that there's a disparity where we get exposed to what those steps are much later than maybe the others, right? Yeah. And so kind of changing that narrative so that people are getting exposure, but also getting kind of the blueprint. Yeah. This is kind of what it takes to get there. These are the steps to get to where you want to be.
Yeah.
I just think your story is so powerful in that like you had, a clear sports trajectory, right? And then pivoted into something that is helping people in an immense way, right? And there's so many people, so many kids out there who have that potential to do that. I want to see kind of lift up to that.
Yeah. Yeah. And I talked to a couple of folks who are, one close friend of mine who's involved with the children's group at the church. And I'm like, I'm open to talk at any point just to kind of share, my background or share what I do and all that. I want to create, more awareness and possibilities. Because right now, what's controlling our kids right now? Social media, right?
Yeah.
So things like this help because it's on social media, but it's, as a parent, you're battling so much, right? And if someone sees someone doing something they shouldn't do, but they're making all this money, well, I want to have all that money too.
Right.
That's the kind of things you're fighting against, not just really putting in the work and grinding and doing what it takes to get to a certain level.
Yeah.
And a lot of it is done by mistake. You kind of stumble upon it.
Yeah.
I believe everyone has a destiny and you're going to get there, regardless of the circumstances, if you put the work in to actually do it. And some things just take what it takes, like I said before. But I just, as I mentioned to parents a little bit ago, it reminded me even of my parents, right? Fantastic people. But it was my mother specifically. It was about what was in front of her, right? Like my brother and I wanted to travel and do other stuff, and and go here for a job and all that. And it was always like, this is why you shouldn't do it. Not go ahead and do that. Not in a bad way. It's just she just wasn't familiar with it, so she didn't want it for her kids, right? Yeah. Now she travels and does everything else, but at the time, with us, it's just not what she knew. It's just wasn't familiar, right? So the point of saying that is, it goes back to, for children in creating a career path, you don't wait till they to turn 18. All right, let's figure out what you want to do. Right. You have to do it beforehand. You have to think outside the box a little bit because things are changing. Like we were talking earlier, I asked how is media changing now? Has it changed dramatically over the last couple of years? What to do as a career is changing some. Yeah. And like we mentioned earlier, sometimes you gotta set your own, create your own table. Yeah. Not necessarily sit somewhere else. Oh yeah. So I think that's done by your parents guiding you first and foremost, and you have to kind of share what those kids' goal is. And one thing I learned by parenting is you got to listen to the kids sometimes. It's not just, this is what I say and that's it, right? Because it's different. And once I learned that and learned that they were being, poured into by social media and everything else, I have to be on the same thought path, the same level to understand where they are, to be able to take them, meet them where they are essentially, to be able to take them where they need to go. So it's a lot on parents nowadays. It's a lot. It's a heavy burden. It's a great responsibility. But if you do it, and do it, we'll say do it right. No one does anything perfectly, whatever. But if your best interest is in your child, being successful and happy as an adult, not rich, happy, and if rich comes with that, great. If a great lifestyle comes with that, great. But I think doing something that you love to do and enjoy doing is essential. But as children, they have to figure out, or teenagers, what those things are, not as a young adult, because it may be too late at that point.
That's right.
You know?
That's right. My kids are young, so we're still getting there, right? But I mean, already they're good with the phone, right, at an early age.
Yeah.
And I think your point is well taken that we want to create children who have open minds where they can use all their experiences, right, to build. So I'll give you an example. I'll kind of encourage the high school athlete, come shadow me in the clinic, right? So, it may be that it works out for you with your sport, and that's great, right? But all that time, you're being exposed to all these different things that go into making that sport happen. You're being exposed to media. You're being exposed to medicine. You're being exposed to training, physical therapy. All these are career paths. All these are career paths. And our goal is to get people, strong people like you here on this show to just kind of give an idea of these are things that you can do, right? And these skill sets are transferable into doing something, that can affect humanity greatly.
Absolutely. Yeah, absolutely. That's the key thing is I think creating some transferable skills. You and I both just mentioned that a little bit ago, how we got that early on in our work careers, and it's translating until now. So I think that's what's important. Nothing beats experience. Experience is the greatest teacher. And once you're exposed to it, that opens up your mind and your thought process. It's not just about, like say a child shadowing you, at that moment. It's the effect of after that moment. And now what else they will see on social media, whatever it may be, they're relating their experience still as part of that whole equation. It's not just, this is what I see and that's it. So the more stuff we put on the computer chip, I call it, like they're blank computer chips when they're born. The more stuff we put on it or expose to them, good or bad, right? That's what they're going to use to create, who they are as an adult. You know what I mean? And it's just, I think the way whether it's by parents or whomever else, coaches or whomever, the way they're guided and how they're guided and who they're guided by, that's just paramount.
Yeah. That's awesome, man. Awesome conversation. I appreciate you coming out.
Yeah,
man.
absolutely.
Any final words of wisdom for the people?
No, I mean, my biggest thing is just, be open to stuff, explore, be open to different career paths, ask questions. I think the number one thing with learning is communication. You know what I mean? And sometimes they may not understand exactly what you do until they ask you or ask me. And the adult and the children, just ask questions and try to find out what it is you want to be able to know or learn from them, or just communicate and talk, and vice versa. Be proactive in communicating. As an adult, as a parent, hey, I'm going to take you here so you can see this. Not the kid saying, well, no, I don't want to go there. Nope, this is what we're going to do. I'm going to expose you to this. We're going to watch this on TV. We create something to get their mental juices flowing a little bit. I think that's what opens up the opportunity to be able to explore different career paths, explore things that are positive, and quite frankly, almost combat the negativity of social media influence too. So
having to be intentional.
Indeed.
Every step. Yes, sir.
That's it.
Well, much blessings to you, brother. I appreciate you.
Thank you.
All right. This has been Level the Playing Field. We'll see y'all next time. More engaging orthopedic, sports medicine, and medicine at large information for y'all. We'll see y'all next time.